A chip in the eye just helped people with blindness read full pages again. The new implant helped people with severe vision loss see again, with some even reading letters and short words for the first time in years. In a major international clinical trial, a wireless device called the Prima implant restored central vision in patients with advanced age-related macular degeneration, or AMD, a condition that causes permanent blindness in millions of older adults. The results, published in the New England Journal of Medicine, show that more than 80% of participants experienced meaningful improvements in their vision, and most could use the device at home to read. One person even gained back the ability to read 12 full lines on a standard eye chart. The Prima system works by taking over for the damaged cells in the central part of the eye. It includes a tiny 2x2mm implant placed under the retina, which receives images from a camera mounted on special glasses. The implant turns those images into electrical signals that the brain can understand, helping the person see again. Patients can also adjust the system to zoom in or change contrast, which makes it more usable in daily life. The study followed 38 people over the course of a year, and the team reported that any surgery-related side effects had cleared up, with strong visual gains seen in most participants. For people with AMD, central vision slowly disappears over time as the retina breaks down, making it nearly impossible to read, drive, or recognize faces, even though side vision remains. While the implant doesn't yet restore full, natural sight, it gives people enough visual function to read and navigate more independently.
What's the maximum resolution of the human eye? According to new research from the University of Cambridge and Meta Reality Labs, it's higher than we previously thought, but not so high that most people will notice a difference between 4K and 8K TVs in a typical living room. The researchers found that from the average viewing distance, our eyes can't actually see all the fine details packed into ultra-high-definition screens, meaning those extra pixels don't always add much to the experience. They tested how well people could spot fine patterns on screens in different colors, lighting, and angles, and discovered that earlier estimates of what our eyes can resolve have been too low, especially for black and white images. That said, the eye's ability to see detail depends heavily on color. People see much more detail in gray, green, and red than in yellow or violet, where the level of detail the eye can detect drops off sharply. This means even though our eyes are capable of noticing more than we used to think, there are still limits, especially when it comes to color and peripheral vision. In fact, a lot of what we see is pieced together by the brain, which fills in gaps and focuses our attention on what seems most important, rather than providing a full, high-res image at all times. That helps explain why bigger TVs or sharper screens don't always look noticeably better, especially if you're not sitting close. The study suggests screen makers could design displays that better match what most people's eyes can actually see, rather than chasing ever higher resolution numbers.
Eye color change surgeries are becoming a dangerous trend, with people increasingly opting for risky procedures to permanently alter their iris color, warns experts. These methods, such as iris implants, iris tattoos, and laser depigmentation, are not just cosmetic but come with severe risks, including blindness. The iris, a complex structure that controls light entering the eye and protects sensitive cells, can be permanently damaged by these surgeries. Traditionally, surgeries involving the iris were for medical purposes like cataract removal or defect repair, but the rise of cosmetic procedures such as keratopigmentation and laser depigmentation has led to a surge in complications. Keratopigmentation involves injecting pigments into the cornea to change its color, while laser depigmentation burns away pigment from the iris to change brown eyes to lighter shades. Both methods can result in infections, light sensitivity, vision changes, thinning of the cornea, glaucoma, and even blindness. Another option is silicone implants that pose additional risks such as altering eye shape and increasing pressure on the optic nerve, which can lead to vision loss. Despite these dangers, people continue to undergo these procedures, motivated by the desire for an ideal look. Experts caution that these surgeries, even when used for treating medical conditions, are fraught with complications. The safest way to change eye color remains using prescribed colored contact lenses, as the long-term risks of surgical interventions far outweigh the temporary aesthetic benefits.